The beneficiaries now we have around 40,217 groups. Most of the groups are around this hospital.
Community health insurance has benefited many. I'll give you an example. Before we began it, one, people would not have access to quality service. Access in terms of coming late, because they would first want to look for money, and by the time they come, maybe they have a complication, say a malaria complication. And that would mean a longer stay in the hospital and also becomes expensive. But also, people would have to look for money. And here, for example, land is very important for every family. So it gives a protection, financial protection. But importantly, we also see that they come to the hospital early, because I don't have to wait to look for the money. I don't have to go to a herbalist first of all, and that has been a benefit.
Right, then if somebody did not have that cover and they had a large health expenditure, would it affect their future potentially?
Yes, this would mean if I am living on a plot of land and I sell it, it would mean I can't do any agriculture, I can't pay school fees for my children, and the whole future of the family has no future really, and so you cannot even save. And of course I must say, if you delay coming, when you come to the hospital and stay longer, then it means you are wasting a lot of time. When other people, it's the rainy season, they are digging for you, are admitted in the hospital. But also it destabilizes the family, and it does contribute to poverty eventually.
So it has great benefits for the individual members of the scheme. What about for the hospital?
I think to a great extent it has created a very good relationship with the community, such that the community see now the hospital as a service provider as their own, and that relationship does in a way contribute to trust. But also too, it would mean if money is upfront, then it can be used to improve on services. Because before the scheme, we used to run a huge debt of patients running away. They would not pay in time. But if I have money upfront, it's even cheaper in terms of treating the patient, because I know if you come through the outpatient clinic, you can go home. But if you come late, if you have been fearing and not having the money to come in time, to remain on the wards, the treatment is for a long time, you stay longer, it's a lot of money, and by the time I ask you to pay, you don't have the money. So in a way, the hospital has hugely benefited from this kind of relationship with the community.
And how is the scheme administered then? Because it sounds like it's quite a big scheme if there are over 40,000 beneficiaries. So have you got a very big staff administering this?
We intentionally run it at a low cost operation, meaning you have a few staff based in the hospital to help manage the scheme, but also we have another structure of the executive, which is actually in the community. For example, if it means remitting premiums, the community does that. You don't have to spend money on that. But also the monitoring of the scheme is both done by hospital-based staff, but also the community. And so there is a lot the community is putting in, and we don't pay for that. That's like a voluntary kind of service they offer.
What about the link with the Mothers Waiting Home? Because I understand the mothers who are members of the scheme have free access. How much is that appreciated?
That is quite exciting. In this part of the country, women do a lot of work, especially in agriculture. Not despite the men, but men tend to be the decision makers. But even when a mother is pregnant, she does a lot of work climbing up the hills and harvesting, cooking, fetching water or firewood. And so the fact that the mother can come and have some time of rest in the hospital waiting to deliver is hugely appreciated by the community. And for the members of the insurance, this is a free service and they love it. The mothers feel respected, they have time to rest, and also sometimes get to know and learn, because during the waiting time they have some kind of health education.
And as a church hospital, would you say that the scheme has helped the Christian testimony?
Yes, indeed, because when you look at the model of Kisisi, it's all about risk sharing and it's benefiting the very poor. And so we are here to reach out to the vulnerable, to the poor, and so it's such a good example, a testimony for the many. I particularly remember a testimony from one family that in the past they had sold land, actually started the livestock. And when we were interviewing this family, they were telling us now they no longer have that fear. This man was telling us that every time they would get sick, they would be worried, oh, we are going to sell land, we are going to sell our cows. But now they live fearless in the sense that I know I can walk to Kisisi, have my treatment and go home. And indeed, they were telling us that most of members of the insurance, the insured people, the community, they tend not to get very sick. That's what they claim. That even when they come, because they come frequently, have their treatment, and therefore they are not admitted. That's what they are telling us. Kisisi has become a model for many places. Actually, in the region, even the government of Uganda is looking at the Kisisi. They are trying to introduce health insurance in the whole country. The bill is in Parliament. But we also have had many people coming from even outside Uganda to come and look at how we've done it in Kisisi. And academics even have had time to look at Kisisi and their benefits that are now documented.
The motto of the Kisisi Community Health Insurance Scheme is affordable access to quality health care. Now, if you look at the world literature, you'll find a lot of information about the financial protection offered by such schemes. But there's also some interesting work we've done here on the health benefits. And we had a PhD thesis written about childhood stunting. And we discovered that every year that a family belonged to our scheme, there's a 5.7% reduction in childhood stunting compared with control families in the same community. So quite an extraordinary impact. And over 5 years, it's more than 28% reduction. So a very significant change. We've also demonstrated that admission rates from our clinics are about 50% for insurance scheme members compared to those who are not in the scheme. And we were amazed by this difference, and we think it's because the patients are coming much earlier in the course of their diseases and so are not so serious, and fewer of them need admission, and they're away from their families for a shorter period of time, and so everything is a win-win situation. This data comes from our Streamline IT system that we've developed in Kisisi and represents over 80,000 people, so a very good sample size over 2 or 3 years. The insurance scheme has over 40,000 beneficiaries in 215 community groups, and so it has a big reach, and integrating it into Streamline has been a great benefit because it's used across the hospital for patient care. It integrates patient safety functionality, and it allows us to analyse some of the usage by the groups. Streamline also provides one-click access to some important national and international guidelines, which then improves the quality of care given on the front line. Harnessing the power of digital technology to improve medical care is a tremendous opportunity, and we're very excited by this programme.
Yes, this has really helped in capturing data or information on the members, and also helping that people do not cheat, because people might take advantage of a weak system and present other people's cards. But this IT system has helped us to be able to One, help in the screening, help in summarizing documentation information about members, also helping in making projections. We have a component of prevention, and for example, we sometimes send health workers to individual groups to health educate them. Use of mosquito nets, for example, how do you prevent malaria, issues of malnutrition, issues of keeping healthy. Yes, that's quite a component, and most of the members will use mosquito nets.
So we've done a lot of health education about some of the cultural practices that are dangerous. For example, there's a local tradition called ebino, which involves digging out unerupted milk teeth from the gums of some of the infants. This is a cultural practice that's usually performed in children with gastroenteritis, and of course normally diarrhea and vomiting is self-limiting, so it perpetuates the myth that the intervention works. But tragically we see some children coming to us with severe sepsis and some of them don't make it. So part of the advantage of the health promotion amongst the groups of the scheme is to try to work to eliminate some of these dangerous things happening. I had one child who came in where the skin had been cut on the chest to scarify, and normally that's benign, but in this particular child he must have struggled, and he came in with a pneumothorax under tension and was really very, very distressed. So these practices can be dangerous, and the schemes helped us to reduce that. And in addition, the linkage with the mother's waiting home has really opened up access to quality maternity care for some of our mothers from very poor backgrounds or remote situations. So lots of reasons why the insurance scheme has made a big difference towards obtaining universal health coverage. If somebody asked you what are the key elements that you must have in place to replicate this successful scheme, what would you answer?
I think one, you as a service provider, you must be of quality service. People must kind of appreciate that you have a quality service. But also two, you must not be seen to be doing business in terms of making profit. And importantly, how does the institution relate to the community? Like I mentioned before, if people have a sense of ownership, then they promote it. But also important areas of management, in terms of monitoring it properly, in terms of community participating in running it, and also in terms of being able to mobilize the community to appreciate the benefits. Risk sharing is a big component of it, knowing that it's meant to help the poor and the vulnerable and who are so unable, and also keeping your premiums so low, because otherwise if we are serving the real poor who are poor people, they may not have much money to pay.
Thank you very much.
Most welcome, and thank you.